Welcome to Business Line's State of the Economy podcast, where you'll find insight, analysis, and the story behind the numbers.
Hello and welcome to the State of the Economy podcast. I'm Jyothi Datta. In the last few weeks, mental health has come in for clear mention, whether it was India's economic survey that acknowledged mental health as a critical part of an individual and a nation's well-being, or the Olympics, where American gymnast Simone Biles came back from a break with a scintillating performance, putting the spotlight not just on the medal she won, but importantly on mental health and resilience as well. In fact, a photograph of her, which she has captioned it as Mental Health Matters. So, in our conversation today, we have Ms. Neerja Birla, the co-founder and chairperson of Mpower, a mental health initiative from the Aditya Birla Education Trust that has been working with corporates and governments, besides running a helpline that I recall during COVID had many people calling in. So thank you, Ms. Birla, for being here.
Thank you so much, Jyothi. It's an absolute pleasure and lovely to talk to you on this very important topic. Of course, it's a topic which is very close to my heart, but I think on a larger landscape, it's become extremely important, in this day and age that we bring it to fore. So very happy to talk about it.
Absolutely. So, Ms. Birla, Mpower had come out with a report on the mental health in the Indian workforce, and it was titled "The Silent Struggle." So, could you outline for us the key insights in that study?
So, we had conducted a survey in corporate India. For corporate India, we covered, different industries, different segments and different age groups, also covering men and women. So it was basically to outline and to get an understanding of what is the current state of mental health in corporate India and across various industries. We also wanted to understand, what is the kind of awareness that there is, what are people doing really about mental health struggles, and how rampant or how deep is this challenge, and also wanted to understand whether it is industry agnostic or whether there are more mental health concerns in particular industries over the other. So there was a whole gamut, a whole range of data that we were wanting to collect and address.
Absolutely. So I did, go through the report, and team has spoken to a range of people from CEOs to employees and various levels. So what is it that they were saying? What is it that you all found? And how do Indian corporates, for instance, stack up against their foreign counterparts?
Statistics-wise, that women are more prone and, have to deal with more mental health issues than men. People are not willing to really talk about it. Even amongst corporates and in the corporate world, there's very, very small percentage of people who are willing to talk about it. So, it definitely indicated a lack of awareness, and it also indicated a high level of stigma, which means that even if people were aware that they may be having and grappling with mental health concerns, there was always the fear of being labeled as unproductive, or there was a fear that they may lose their job if they were to talk about it. So the stigma being very high, people were not willing to address those issues and were not willing to really seek help. Women were faced the brunt of it more than the men in terms of dealing with mental health issues, and also in terms of just feeling victimized and discriminated against.
So despite all the conversation that is happening these days compared to maybe several years earlier, you still find that it still is pretty much stigmatized, and people are not comfortable to come out, especially in their workplaces. And companies say that they do have these support systems in place, but I think your report found that was not as prevalent as it should be.
So, the report was a couple of years ago, and I think even since then, the needle is moving very, very slowly. The change is very, very minuscule, but there is a change. And as we know that to create any kind of cultural paradigm shift, shift in mindset, it does take time. So having said that, and given the fact that it is going to take time, at least the work has started. So when we started out 8 years ago to now, there is already, of course, a very big change. There is a huge shift from the time when, just to give you an example, when we first started out, our first press conference had two people, two journalists who attended it. It was so demotivating, to say the least. From there to now, where it's become a conversation for center stage, people are definitely talking about it, people are taking note. It is spoken about in the media. So that in itself is very indicative of a shift happening out there. Is it something that we want to be satisfied with? Is it something that, okay, we can say that, okay, now we've arrived and, it's completely out in the open? No, absolutely not. There is still a lot of work that needs to be done. There are a lot of steps to be still taken. But I am very positive because there is a positive change. So I think even in corporates, from there being not spoken about at all to at least conversations happening, there is a shift. But however, Indian corporates still lag behind the global standards in comprehensive mental health support, whether it is awareness or implementation, there is a huge gap. I think the multinationals in India are actually leading the way because they are aligning, and it's mandatory for them to align with global policies. They're trying to integrate mental health into their overall wellness programs. They have dedicated mental health days. So the multinationals are definitely paving the way. The Indian corporates hopefully are lagging behind, but hopefully should catch up very soon. And I think still the stigma at workplace is still quite rampant because people still, don't want to talk about it. They don't want to go to they don't want to talk about it amongst their peers. They don't want to go to their bosses to talk about it because I think they very often feel that, what if the boss thinks they're not good enough or, asks them to leave. So I think all this still exists. But I am very hopeful and there are definitely positive steps towards it. So it would be unfair to say that there's just no change at all.
Right. So, you've talked about, how the conversation has been evolving. Now, a recent point of discussion has been on the call for longer work hours, for instance, and that has generated a lot of discussion at various levels. So, at the helm of a mental health initiative yourself, what would you say on this for longer work hours?
So, I genuinely believe that you don't really need longer work hours to complete your work. And when you say longer work hours, means obviously you wouldn't want to have a day where every day is just a 4-hour day. But, given the fact that it is a 7-8 hour day, I don't think there is a need to make it longer than that. In fact, on the contrary, if you're not able to complete your work in that amount of time, which means that you really need to look at, the ways that you're approaching it. Maybe you're not efficient enough, the reasons why productivity is low. So just increasing work hours is not the answer. I think you need to understand why is the productivity low if that is the case. And in fact, a point that goes towards that is that very often, when you're grappling with mental health situations, you may be a very high achiever, you may be intrinsically very bright and very, very productive. However, if you are facing challenges, it could be, something as commonplace as anxiety, it is definitely going to hit your productivity. You cannot be as productive, if you're dealing with anxiety and terrible anxiety on a daily basis because you're first having to fight, those demons in your mind. And then there is very little mind space remaining to really, have a great output at work. So therefore, it becomes very essential to then address those issues. So there could be many reasons for productivity being low and mental health challenge or facing a mental health concern is definitely top of the list.
We've seen a lot of initiatives that are being started on mental health, and that's the heartening part in terms of support at various levels, various age groups. And yet you say there is, there is this overhang of stigma. So the resource point of view, as in the human resources, and in terms of affordable resources as well for people to reach out to, how do you evaluate that? Because when we see with the regular doctor-patient population, we already see the numbers are not enough. So how is it in mental health?
Treatment gap, even in mental health, is a lot. It's a very, very wide gap. So, for example, it could range between 28% to 83%. That's a huge one. And for common mental health disorders, it's about 85.2. Just to give you some idea, I'm giving you these stats just to give an idea of the extent of the problem. So, the fact is that there are a lot of Indians at risk. Percentage of people dealing with mental health issues is very, very high. However, the infrastructure, the medical professionals, the resources is not enough at all. And even the expenditure that we do in this is very low. It's only about 3% of the total total health expenditure that is done for mental health, whereas other countries spend anywhere between 5 to 18%. So I think it's a combination of not having enough resources, not having enough, for example, psychiatric resources in terms of colleges. Therefore, you're not churning out that many psychiatrists and counselors. So there are a lot of reasons for this wide treatment gap, and really needs to be addressed, because unless we don't build capacity, our population is increasing, the number of people facing mental health issues is increasing, but our resources and our people to tackle those resources are not increasing, and the treatment gap is only going to get wider. So it's extremely important to do that as one of the main turning points that can really make a huge difference. As far as the cost is concerned, definitely one of the main things is that in mental health is covered under insurance, but it's not adequately covered. So for example, OPD services are not covered under insurance. A lot of times people are actually just going to OPD for mental health services. What is covered is inpatient, but there's a very small percentage of people who are going for inpatient services. So while the insurance covers mental health, it's not adequate. So making changes in that would also encourage people to avail of the mental health services. Obviously, and there is also a lack of awareness of what really the insurance offers. So maybe, getting to know that more, and definitely increasing the coverage in insurance would also make a very big difference. For example, substance abuse is not covered. Addiction is not covered under mental health, and therefore it's not covered under insurance. So making that change would also really help and go a long way.
Absolutely, you nailed it there, because that's something one often hears with health insurances not covering the OPDs, and much of the conversation happens at the counseling levels, and even that for a lot of young people it can be quite expensive. So I think health insurances should be sort of tuning in there and figuring out how to be making themselves more approachable and affordable.
I also feel, Jyothi, that I think culturally, as a nation, we do not put as much emphasis on mental health as physical health. So, for example, the same cost that you may want to be and would be okay spending over physical health. For example, if you have to go and see an orthopedic, for example, you're okay to spend that amount, but the same value, the same amount that if you need to spend that, going to a psychiatrist, for example, or going for a counseling service, you are going to think 3 times that should I or should I not? You will see the opportunity cost of that. You will see, is there better use to the money? So if we are able to, make that cultural shift also, and that therefore awareness becomes critical and very important, so that people realize the value of mental health. If people realize how important it is, how it can be a game changer, then you assign that much value to it, and you don't mind spending that same amount that you would do for physical health. So that also really determines the willingness to pay for mental health services.
Correct. That's correct. So, Ms. Birla, the last time we've spoken was probably during COVID, when you started the helpline. Then you worked with BMC, but the area of operation in that sense has sort of expanded. You work with the CISF, with NIMHANS. Now you have an alliance, and I think several other state governments or the centers with. So, could you just update us on what are some of these services that are being provided across with these other institutions?
We have really grown exponentially since then, and where we are engaged with several projects, a lot of them with the government. So we do believe in public-private partnership, and some of them are other programs which are not necessarily related only to the government bodies. Just to talk about a couple, the one that we're working across Maharashtra, where we're aiding the district mental health program, where we're closely working with 40 primary healthcare centers. So we cover all districts in Maharashtra, and we are conducting mental health literacy sessions. We screen individuals at the PHCs. We have clinical sessions and a lot of counseling sessions as well. And as a result of this, our efforts have not only helped improve the mental health awareness, but because we've been able to reduce barriers to accessing crucial mental health care, that's really resulted in increased productivity, because they now don't have to spend hours to get to the center, to get to the PHC, because we've just made it more accessible, and we've covered all districts in Maharashtra. And through the district mental health program, we've also been able to make psychiatric drugs more easily available to the people. And that's really working at grassroots level, because, very often people, the community would go to a PHC just for a regular physical health checkup. But because we've introduced screening at individual PHC centers, everybody who goes there gets screened, and then we are able to therefore identify at-risk patients, which otherwise would have gone completely missed. And out of that, then about a good, 8% of individuals then avail of mental health help. So that also has really helped, because, they're able to realize the value of, and then those people have actually come back feeling better. So they've realized the value of it. So, so across Samvedna, I think we've had really fantastic results, because whether it is identifying and addressing needs, whether it's economic impact, whether it's just generally creating awareness, we've seen huge qualitative gains, economic benefits, and it's really helped strengthen the entire healthcare system, because we've been able to bolster the existing government infrastructure. We've provided additional mental health professionals, and we've supported medication. So it's been, it's been a successful program across Maharashtra, and we're now ready to take it to other states as well. We have the proof of the pudding that it has worked. It was, something that hasn't been done before, but I'm really happy that it's worked out successful. So that was about Samvedna. Then we also have what you were talking about, the collaboration with NIMHANS, is Telemanas, which is a 24/7 helpline, which again provides accessibility to mental health services. And, where they're also able to expand the implementation of NIMHANS support services, and that's across India. So like that, we have several other programs. One that we're not working with the government is called COPE, which is an entirely student-led community program, which we have introduced in several colleges across India. We're right now currently in about 40 colleges. And, we just rolled it out last year, and it's, also proving to be quite successful, because we're able to create mental health first aiders. And those first aiders, 25 per college, are then available for peer-to-peer support. There's a lot of conversation about mental health going on, and we want the youths to understand that okay not to be okay, but it's very important to seek help. We're really trying to encourage awareness at one level. We're also trying to encourage help-seeking behavior at another. So, these are just three of the projects that I've spoken. There are several others, so we've really grown exponentially, and I'm really happy with what I'm really happy about is also that now government agencies are asking for help. They're asking for us to come on and be their mental health partners. And that, I think, in itself is a testament to the benefits that people are seeing in taking mental health support.
Absolutely. To just normalize these conversations and not make it something that, is out of the ordinary in that sense. Yeah. I do believe you're coming up with an initiative for sports people as well. Is there something that you could tell us on that?
We're just launching a program called AMP, which stands for Athlete, Mind and Performance. And it's a whole new vertical that we are launching under Mpower for sports psychology. So when we started Mpower, we had actually, I was very keen to do sports psychology back then, but I think it was a little, ahead of its time. But now I think the conversation around mental health itself has garnered a lot of attention. And now even sport, especially with the Olympics just getting over, it's really important to introduce something like sports psychology. Very, very crucial. I think mental health in sports is a game changer because, everybody who's out there in sport goes through a lot of emotional turmoil. And by just acknowledging that emotional toll of competition and then providing the athletes with the accessible and correct customized support system, I think we will be able to really transform the sporting landscape. I think we'll be able to really, if we're able to foster a culture of openness and empower the athletes to perform at their best, at their optimum, both on and off field, that I think will really go a long way.
That's really interesting. We'll keep an eye out on that, when you'll do launch that. And you're right, it's really been brought home to many of us, watching the Olympics and the tremendous pressure on and off the field that our sports people face.
Yeah. At that level, when you're an elite athlete, or for any athlete, actually, for that matter, all athletes will put in that amount of physical training, right? You're obviously wanting to improve your skill sets as far as the particular game is concerned. And you will put in X number of hours to get your game up to that level to be able to compete at that level, right? So once you're out there, everybody in terms of skill set and talent and hard work is pretty much at the same level. But while you're actually in the sport, and that is the crucial game changer, right? How do you perform while in the match? How do you perform while playing the game? And having the right mental health support, which you've had before, so that helps you perform your optimum and your best. That is a game changer. And I think at that level, if you're able to support our athletes with that kind of skill set of how do you manage your stress, your anxiety, your pressure while competing, I think that can really help tilt the balance.
Right. So with that, we come to the end of this interaction. From the BL team and myself, thank you, Ms. Birla, for your insights and time. We will stay in touch for more conversations on mental health in the future.
Thank you. Thank you so much, Jyothi. Lovely talking to you.